Greetings to you, stranger. Are you in search of knowledge? If so, you're in the right place. In my lab, you will find answers to all your questions. Today I will tell you about vitamin D3. Vitamin D3, cholecalciferol, is most well known for promoting bone health. But this vitamin is also pivotal for boosting the immune system, enhancing mood and muscle function, and supporting heart health. Taking a vitamin D3 supplement may help you achieve glowing skin and better mental clarity. Commonly called the sunshine vitamin, it is an essential nutrient for overall health and wellness. Bone health. Vitamin D3 plays a crucial role in the formation and maintenance of strong, healthy bones. This vitamin is important for bone health because it enhances the absorption of calcium from your digestive tract, regulates the use of calcium and phosphorus for proper bone formation, supports bone repair to maintain and regrow bones as needed, prevents bone disorders, such as osteoporosis and rickets. Low calcium intake and vitamin D deficiency are directly linked to the onset of osteoporosis. Researchers have found that older people who take vitamin D3 supplements and calcium supplements have a reduced risk of hip fractures and non-vertebral fractures, bones outside the spine. Immune system. Vitamin D3 regulates immune responses, ensuring your immune system responds appropriately to pathogens and other suspected invaders. Your immune system requires vitamin D3 because the vitamin enhances the immune system's ability to fight infections, boosts the production of peptides that help defend against bacteria, viruses, and fungi, regulates inflammation, helps prevent the immune system from attacking the body's own tissues, boosts overall immune strength. Some studies suggest that vitamin D supplementation may reduce the severity of certain autoimmune diseases, such as rheumatoid arthritis, multiple sclerosis, and Sjogren's syndrome. However, there is no consensus on how best to use vitamin D3 to prevent or treat autoimmune diseases. Low vitamin D levels are associated with increased symptoms of depression and anxiety. In fact, some experts recommend screening for low vitamin D levels when developing a prevention and/or treatment plan for these disorders. Vitamin D3 is beneficial for your mood and mental health because it regulates neurotransmitters, including serotonin and dopamine, which are responsible for regulating mood, supports the brain's ability to learn, organize memories, and adapt to changes, neuroplasticity, reduces inflammation, which has been linked to several mental health and mood disorders, including depression, anxiety, and seasonal affective disorder. Numerous studies have examined the direct and indirect relationship between vitamin D and mental health. One standout revealed that people with vitamin D deficiency may be 75% more likely to develop depression compared to people with normal vitamin D levels. Muscle function. Although not everyone with vitamin D3 deficiency experiences symptoms, those who do commonly report muscle twitches, muscle pain, and muscle weakness. Vitamin D3 is beneficial for muscles because it maintains muscle strength, supports the contraction and relaxation of muscles, improving their performance, prevents muscle cramps and weakness by maintaining calcium levels, promotes muscle recovery after exercise by reducing inflammation and promoting muscle tissue repair, reduces muscle fatigue, weakness, and falls. Enhances overall exercise performance and endurance. Cardiovascular health. Adequate vitamin D levels are crucial for preventing calcium imbalances. In severe cases, imbalanced calcium levels can lead to severe heart complications and may contribute to heart disease. Vitamin D3 is beneficial for heart health because it plays a key role in regulating blood pressure, reduces inflammation, protecting the heart and blood vessels from cardiovascular disease, supports endothelial health, which is crucial for proper blood flow. The endothelium is the layer of cells lining the blood vessels, helps clean arteries and prevent atherosclerosis, or the buildup of plaque in arterial walls, a significant risk factor for heart attack and stroke, supports healthy cholesterol and triglyceride levels, thus reducing the risk of heart disease. Metabolic health. There is substantial evidence that taking a vitamin D supplement can help improve glucose homeostasis, steady blood sugar levels, insulin sensitivity, and overall metabolic health. Vitamin D is beneficial for metabolic health because it regulates insulin sensitivity, which is important for managing blood sugar and preventing type 2 diabetes, reduces inflammation, a significant risk factor for numerous metabolic disorders, including obesity and insulin resistance, helps your body break down, metabolize, and store fat. Metabolic health. There is substantial evidence that taking a vitamin D supplement can help improve glucose homeostasis, steady blood sugar levels, insulin sensitivity, and overall metabolic health. In people with prediabetes, taking a daily vitamin D supplement has been shown to reduce the risk of progression to type 2 diabetes. Glowing skin. For people who wish to brighten dull skin and prevent or relieve inflammatory skin conditions, maintaining healthy vitamin D levels is critical. Vitamin D3 offers numerous benefits for skin. Vitamin D3 supplements and skincare products containing vitamin D are often recommended for people with sensitive, mature, and aging skin, and skin that is prone to redness and visible blood vessels, capillaries. Cognitive function. Vitamin D3 is thought to have many benefits for your brain and cognitive health. Digestive health. A growing body of research shows that vitamin D supplementation has positive benefits for digestive health. People with irritable bowel syndrome, IBD, often have vitamin D deficiency, even during remission. Having a reduced level of vitamin D is also a risk factor for worsened IBD symptoms. Pregnancy health. Vitamin D deficiency is a significant risk factor for several problems in both expecting mothers and their infants. Vitamin D supplementation may also reduce the risk of the infant developing attention deficit hyperactivity disorder, autism spectrum disorder, and other mental development issues in childhood. Cancer prevention. Researchers started investigating vitamin D's role in cancer prevention after noticing that people in southern regions with high sun exposure appear to have lower cancer rates and mortality compared to those in northern regions with less sun. Weight management. Vitamin D supplementation appears to have several benefits for people with overweight or obesity who are trying to lose weight. Vitamin D3 is beneficial for weight management because it helps regulate hormones, like leptin, that are involved in stimulating appetite, promotes a healthier body composition with less excess fat and more muscle, boosts muscle function and strength. Having more muscle means you burn more calories at rest. Hair loss prevention. Vitamin D deficiency has been linked to several hair loss disorders, including telogen effluvium and alopecia areata. It has also been linked to scarring alopecia, a disorder that results in permanent hair loss. Supplementing with low levels of vitamin D3 can effectively improve symptoms of these alopecias due to the vitamin's anti-inflammatory and immune-modulating effects. How much vitamin D3 should I take daily? The National Academy of Medicine recommends a daily intake of 600 IU of vitamin D for people ages 1 to 70, and 800 IU for adults ages 71 and over. The majority of vitamin D intake should come from food. The maximum safe dose of vitamin D3 is 4,000 IU per day. Do not exceed this amount without consulting a healthcare provider. Symptoms of vitamin D3 deficiency. Not everyone with vitamin D deficiency experiences symptoms. When symptoms do occur, they may include muscle pain, bone pain, increased sensitivity to pain, tingling or pins and needles, sensations in hands or feet, muscle weakness in body parts near the trunk of the body, such as upper arms or thighs, muscle weakness in hips or legs, which may cause you to waddle while you walk, increased risk of bone fractures, muscle spasms, bowed legs. When is the best time to take vitamin D3? Vitamin D3 is a fat-soluble vitamin. This means that taking it with fat helps it absorb better. It doesn't matter what time of day you take it, but you should eat fat-containing food when you do. How much vitamin D does sun exposure give? With all these variables in place, it can be difficult to say how much sun a person needs in order to make adequate amounts. A young, light-skinned, lean person will make vitamin D more readily than an older, dark-skinned, overweight person. Light-skinned people can usually tolerate 10 to 20 minutes basking in the sun, while dark-skinned folks could handle 90 to 120 minutes. Possible risks. Vitamin D3 is generally considered safe, but it can occasionally cause toxic effects if you take too much. This is referred to as hypervitaminosis D. With vitamin D toxicity, the balance of minerals like calcium and potassium is upset. This can lead to a condition known as hypercalcemia, in which too much calcium builds up in the body. You've seen it all the way through. Congratulations, you belong to a smaller part of people, to the part who want more. Write what else you would like to learn about. Join our community. Results matter.